10 British women are to be given life-changing transplants to enable them to have children. Doctors have been granted approval to carry out the UK's first womb transplants. This follows the success of the procedure in Sweden.
Well, one woman who's hoping to be one of the 10 women to have the operation is Sophie Lewis, who was born without a womb.
I think when I found out when I was 16 that I wasn't going to be able to have children, the only route was adoption or surrogacy, which is still a fantastic route to go down, but to be given an opportunity to carry your own child is just incredible. I mean, to actually feel, you know, your baby growing inside you instead of watching sort of someone else carry it is just, it's an emotional roller coaster.
My goodness, I bet it is. We're joined now by Dr. Sarah Jarvis. This is going to give a lot of hope and possibly something concrete as well for those who really want this operation.
Well, what's so extraordinary is the first ever womb transplant was carried out in 2000, and yet it wasn't till last year that the first woman actually gave birth to a baby in Sweden, and that's really what's brought this on. There was a study in Sweden, 9 women had a transplant. Now we've got ethical approval for 10 women in the UK to be given this opportunity. There are 100 waiting already, but we're talking about many, many more who in the future could benefit.
What sort of women will be eligible?
Well, most women who don't have a womb either don't have it because of cancer or because they were born without a womb, and there is a condition which affects about 1 in 5,000 women called... Yes.
It's got a long name.
It's got a very long name. The Rokitansky Husterkauser something at the beginning. It's a very, very long name, and apologies every so often. I think when we run to 4 names, it's pushing it. But they do have their tubes. And they have their ovaries. So what's going to happen in this case is they'll be given basically IVF to remove an egg, to fertilise it with their own partner, and then once they've had the transplant a year later, because they need to be on immune suppressant therapy to damp down their immune system to stop them rejecting the womb, and of course that carries the risk of complications as well. So after a year on that, then they will have the eggs implanted, then they'll have the baby, hopefully, and then after that, 6 months after that, and this is where it's really unusual, in fact I think really a first, 6 months after that, if they decide then not to try and have another baby, then the womb will be removed to stop them being on therapy to damp down their immune system for the rest of their lives.
So you say that this is the women eligible currently, those who are born without a womb or those who have lost their womb because of cancer.
Yeah.
What about women who simply can't get pregnant for other reasons? Is this an option?
This is not going to be an option for them. All of these women are going to be having IVF anyway. And if you've got your own womb, then it's not going to be for you. But, you know, 40 years ago, we didn't think IVF was going to be an option.
Some people can't carry children, can't they? They conceive but can't carry. So I'm wondering if they're the people that might be thinking, this could be something for me.
They may, but of course one of the things to bear in mind, there are lots of causes for women not being able to carry babies. Now, it's possible, interestingly, up to 1 in 4 women who can't carry a baby who has recurrent miscarriage. It's because of a problem with their womb. And it may be that in the future, this might offer hope to them.
Okay.